What about the practice of medicine? How does the practice of medicine change in the next 10 years?
Well, I would say if there was one single change, and of course there are going to be many, it is the decrease of the autonomy and the variability. We have always had a unique range of choice as a physician compared to other industries, where the individual physician can make choices that the organization really has no say in. I think that's changing as more physicians are part of provider organizations. Provider organizations are being part of larger organizations, whether they're health systems, whether they're bought by other payer, provider, deep integrated networks. At the end of the day, that autonomy of choice, which has some great benefits and it also has some great costs and variability, will narrow.
Reduced clinical variation has proven to be valuable, but if you reduce that choice, the physicians I've talked to who talk about it as the art of practicing medicine,
Sure.
that sort of becomes more of a challenge for them. Is that?
Yeah, we were talking about the other night. I was bringing up one of the challenges, especially with technology and health, is that we tend to bring examples from other industries, but most of those industries are based on a product or a service that is engineered and computable. It's a thing that's been built.
Right.
Even though we're more deeply understanding the whole human genome, at the end of the day, people are not built and computable. Therefore, much of our technology doesn't have quite the same degree of precision. And therefore, it needs individuals, doctors, nurses, and others, who can interpret patient wishes, who can sometimes impute a range of options. And that's why, for example, you don't talk to patients and use a lot of medical jargon, you confuse them. At the same time, you can't be so simple that you don't give them enough details to help them make choices. Trying to digitize that is not just wrong and folly, it goes against, I think, what it means to be a human. So I think there's going to be less variability, but ideally there will be even more than attention to humanity, interpersonal relations. We talk a lot about patient engagement now. We never talked about patient engagement during my training. So while I talk about more adoption of technology, we also are adopting more of the humanity than we ever did before. So I'm not worried about losing the art. If anything, I think we're actually emphasizing both reduced bad variability and enhanced attention to the person wellness of the individual, wellness of the providers. All these things are getting more attention now than they ever did before.
Fantastic.